With me now is Steve Walls, a spokesman with Sheba Medical Center, a large hospital near Tel Aviv, well equipped to handle the coronavirus crisis. Steve, thanks for being with me. I understand now there are dozens of coronavirus patients at Sheba Medical Center. Are you equipped to take on even more COVID-19 patients if needed? And if there's a rise in critical patients, what's the situation like with ventilators?
Okay, so first of all, I can say that Sheba has been prepared for a second wave before the end of the first wave. The problem is that we didn't expect the second wave now. We expected it obviously in the wintertime. However, all the equipment is in place. All the beds are in place. We have a nice reserve of ventilators, and we're not in a rush to put people on ventilators because we've learned from the first time that putting people on ventilators, we're better equipped to deal with the virus now, and ventilators are sort of being used as a last resort.
Steve, you mentioned that's one of the lessons learned from the first wave, and really the international lesson, that ventilation as a last resort, that it may not be an effective remedy, treatment for the coronavirus. I want to ask just maybe other lessons that you learned from the first wave, the remedies perhaps that are being more effective in treating coronavirus patients that your doctors and staff learned from what we saw in the winter.
So what I've learned in speaking to our doctors here, as you know, there have been several drugs on the marketplace, from remdesivir to a steroid called dexamethasone, that it turns out that our doctors here who have been using that steroid during the course of regular operations, you know, people who go through regular operations sometimes contract pneumonia, and so that drug was already being used, and it turns out that we were already using it here from almost day one when critical corona patients were here. Therefore, our doctors have sort of been really working very hard to compare notes with their colleagues abroad and also within Israel, and we seem to be in a much better position to deal with the, hopefully not a crush, but the rise in number of critically ill patients. And again, that definition is changing day by day as well.
Steve, I'm not making light at all, of course, of this second wave. We are seeing a dramatic rise in confirmed cases, but the evidence also seems to show that this second wave is less deadly, that the number of critical patients and the number of deaths isn't correlating with the exponential growth in daily new cases. Any idea why that may be?
So, as you know, the world is still trying to figure out what this thing is called COVID-19. It seems to have different effects on different types of people in different countries. We don't know if it's because of blood type. We don't know if it's because of environment. We don't know if it's because of the diet. Obviously, going forward, we'll find out all of these answers. But it seems that going forward, the doctors here have been able to find sort of the right combination of treatments to deal with all kinds of cases, from a 3-week-old child that we have here now to people who are in their 80s. And so something's going on with the COVID virus. Something changed. But I have a feeling that the real change is how we are going about treating people, because as you go forward and you have more and more patients, you're able to sort of trial and error, which is all part of medicine anyway.
Yeah. So at this moment, the range of ages of patients with COVID that you're treating, it's from a 3-week-old baby all the way up to people in their late 80s?
Well, I would say that, yeah, we're finding that obviously the people who are the most seriously ill are the more elderly people. However, we do have several in serious condition who are in their 50s with no background or history of special medical conditions. So those people who think that it can't affect a 3-week-old child, we also have a 15-year-old teenager here. It goes across the board, and I think it's important for people to understand to really wear their mask and try and keep their distance, because truly this is not a joke, and the spike in numbers is very dangerous.
All right, Mr. Steve Walls with Sheba Medical Center. Sir, thank you so much for taking a few minutes with us here on Zoom In.